Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today we welcome Matthew Troup. He's a physician assistant and healthcare executive. Today's Kevin MD article is titled, Why I Left Medicine and Why AI Might Convince Me to Return. Matthew, welcome to the show.
Devin, it's great to be here. Thank you for the time today.
So we'll get to your article in a little bit. First off, briefly share your story and journey.
Yeah, so trained as a physician assistant. I graduated from school about 14 years ago and been in clinical practice since that time. I started out in neuro-oncology as someone who got into medicine really from this empathetic point of view. Growing up, really wanted to do my best to connect with humans. And when you're good at science and you have empathetic background, it seems like the natural progression in your career is to end up in medicine. So probably like most, that's kind of where I naturally landed.
Mm-hmm.
And moving into neuro-oncology to start was such a wonderful landing spot for me. I walked into this department serving mostly patients who had terminal illnesses. And so I got to spend this wonderful quality time with them at the bedside, listening to and not sacrificing what else had to happen in that moment, and rather just engaging with them. And so my first couple of years of medicine really felt like I was living out this kind of perfect experience of what I wanted from medicine was quality time with patients. And then later after that role, I ended up spending about a decade in hospital medicine, spent the COVID pandemic at the bedside in a hospital in Chicago. And then eventually made the move to digital health and looking for ways to find solutions to our clinician burnout problem.
So you mentioned that the first few years of your clinical practice was what your ideal was. Tell me what happened to that ideal as you progressed through your clinical career.
Yeah. So what happened, I think what happens mostly to most clinicians during this process is you come out of school and you understand that you want to deliver the best quality care possible and spend the most quality time with patients as you can. And then what often happens is over time, the number of tasks and the patients you have to see in a given shift starts to balloon and increase, and the time actually spent with patients starts to decrease. And so as I moved through my career, and a lot of this is exacerbated by, in the last couple of years, by the COVID pandemic, I reached this breaking point where I couldn't give the time and energy to patients that I wanted to without having to sacrifice something else. And the data reflects this, I think, on any given shift where providers are spending 15% of their time in front of patients. And so the other 85% of time is spent on all these other things that start to pile up over the day. And so, my previous role at the hospital I worked at, I would walk to work. As I would walk to work, it was about a 10-minute walk, and I would already feel this sense of dread that 12 hours was not going to be enough time to do all the things I had to do, but also not sacrifice that time with patients that I was committed to. And so there's this balance that you have to strike where I'm not sacrificing that time and the empathy that I want to provide my patients, but I also know that I'm going to push those hours later into the day. And now what we know ubiquitously as pajama time is going to happen night after night. And eventually there's a breaking point there.
Your Kevin MD article is titled, Why I Left Medicine and Why AI Might Convince Me to Return. When you make that decision to leave clinical medicine, was it a singular event that tipped you over the edge, or was it just a culmination of what you described over the years that brought you to that breaking point?
A culmination. There's not a single moment I can look back to and say, yeah, this was the straw that broke the camel's back. But as I look back, I can see that this was, the symptoms of a bigger issue that were starting to pile on top of each other. And it's easy to see now looking back, but at the time it felt like more stress about the job itself. Again, that sense of dread that I would have going into my days in the hospital, knowing that it was just not going to be enough time to really deliver the care that I wanted and have to start to sacrifice in ways that I didn't want to. I think that more recently in the, once in a generation COVID pandemic started to exacerbate that and pressure test an infrastructure that was poorly designed in the first place.
Mm-hmm.
And we started to see even worse outcomes from, this health system that has, largely been built on outdated infrastructures, poor digital technologies. And so, yeah, in the last years, it's probably been even more apparent to me, but I'd say it was a progression.
So your Kevin MD article talks more about this journey. Tell us why you decided to write it and what it's about.
I think there's a lot of guilt that comes with leaving the practice of medicine. So much of us have invested a lot of time, whether you're a nurse, a nurse practitioner, PA, MD, social worker, we have all committed to the journey of medicine and providing humans what they need to live their best lives. And at some point in time, you realize that that all of that work, all that effort, is starting to break me internally, and that burden has piled up, and I am starting to feel what now is burnout. And it's hard to accept that. I think the first time I actually used the word burnout was long after I left my role in healthcare, because it's hard to accept. There's a guilt that comes with it, but it is the reality. And the research is starting to show that that is true in multiple ways.
Mm-hmm.
Recent articles that even show how there's just not enough hours in the day for a primary care physician to do all the things that they need to do. And so I started to think about what opportunities would exist outside of healthcare that could help change the way in which we practice as clinicians. And I think that technology offers the clearest line of sight to changing the paradigm. I think the digital health tools that providers have been given so far have not necessarily delivered on the promises that we've expected. Oftentimes, the tools are full of friction or clearly designed without any intentionality towards care team workflows.
Mm-hmm.
But it doesn't discount the fact that technology actually can play a meaningful role in how we practice medicine.
Tell us more about some of these tools that you're working with and what makes what you're doing different from the countless of other healthcare professionals who try to move that needle in that health IT space.
Yeah, and there's been a lot of us who have done it, and there's a lot of great technology out there, and there's really a lot of, I think, a more meaningful push now to design technology that actually does impact care. I think a lot of times we've leveraged digital tools more focused on patient engagement, and it's been at the expense of the care team experience. And what I'm really focused on now is how do we leverage technology that can simultaneously improve the patient experience and also the care team experience, because it is possible. And I think the clearest opportunity for that is leveraging advancements in AI. I think there's still in some areas we still need to understand the impact it can have, and making sure that we're setting proper safety guidelines so that we don't affect patient care negatively. But the research and the innovation that's happening right now provides an opportunity for us to augment the way that care teams practice. And I've started to see that firsthand. The work that I'm currently doing at Memora, really intelligently enabling providers to practice better medicine, give them more time back in their day, and also make the patient journey patient feel much more supported during their patient journey.
So tell me more about what you're doing and how your interpretation of AI improves both the patient and the clinician experience.
Yeah, so specifically to what I'm working on and dedicating my time to right now is building a platform that leverages AI to connect in a very human way with patients, and we prioritize SMS text as that platform.
Mm-hmm.
But to interact with patients automatically and use NLP techniques to answer questions and generate responses, so that there's a first layer of interaction that can be taken off of clinicians' plates. Very much in the news right now is the burden of in-basket messages
Yes.
that are piling up for clinicians. I myself in hospital medicine know this quite well, as it's just one of the tasks that you have to do as part of your 12-hour shift.
Mm-hmm.
And every one of those messages, 2 to 3 minutes at a time, takes away from that direct patient care that I want to be delivering. And so if this platform can start to remove that, and that's the evidence we've seen so far, it can free up the care team's time and energy and have it refocused into other areas. But at the same time, there's an opportunity for peace of mind there for the clinician, because whenever I discharge a patient home, I am always thinking about what's going to happen in the next hour, the next day, the next week to that patient. Oftentimes, and this was even more true during COVID, I would pick up the phone and call the next day because I just wanted to make sure that, oh my gosh, did you pick up your medications? Did you make that appointment with your provider to go see them after discharge? But now there's a platform that actually automate those steps and provide that information back to me in a longitudinal way. So I can understand that these touch points, these milestones have been achieved by a patient, but I'm not having to take time away from other patients to do that.
So give us a case study or a story of your AI solution in action that can really just illustrate a point and paint a picture in our listeners' minds.
Yeah, it's a great question. One of our programs that is most effective and I think best captures this is a postpartum program that we build in partnership with a few different health systems. And you think of the postpartum journey, which is a great example of a time in a patient's life when there is just a brand new experience,
Mm-hmm.
a multitude of questions, and a lot of unknowns that have to happen. And you think about a mother going home with a newborn, and it's similar to my previous comment, leaving the hospital, and both the care team and then also this new mother thinking, what's next?
Yeah.
And so our program is able to anticipate the needs that happen on a maternal journey and guide that patient proactively through that process, ensuring that they feel well supported. And in the middle of the night, if they have a question about, one we get quite often is about baby poop, or a question about feeding, that text message, that's just a text message away for them to get that answer. But yet there doesn't have to be somebody on the other side of that in that moment to answer it for them. And then the care team can, again, ensure that patient or that new mother feels well supported in the journey. They have the data points to understand that they're tracking and trending in the right direction. And, we see just this wonderful interaction that happens. Patient satisfaction scores are wonderful for that program. And the care teams really feel like it augments the way that they can practice.
So is the AI technology, the natural language technology, is it to a point yet where the information that it's giving is universally medically accurate?
Yeah, for us it is. So we use natural language processing and AI to interpret what a patient texts into our platform. But the response that is sent back to patients is from our database of content. We write all that content. We use evidence-based guidelines to write this thoughtful and empathetic content, but it's all designed by us. The platform itself at this point in time is not auto-generating a response to that patient. So we actually have the ability to control it for now. I think there's a future, and we're seeing that already, where generative AI could be unleashed to start to respond automatically to patient inquiries. But I think there's still a moment in time here where we have to be careful, and and it's okay to be risk averse at this point in time, when we all have played with ChatGPT, surely, and we know that it's not always accurate. And so we do need to be delicate with what we're sending to patients at a very important time in their journey. So Memora prioritizes this retrieval-based model to send only content that we create.
We're talking to Matthew Troup. He's a physician assistant and healthcare executive. Today's Kevin MD article is titled Why I Left Medicine and Why AI Might Convince Me to Return. Matthew, in the next 3 to 6 months, the foreseeable future, in that intersection between AI and healthcare, what kind of trends do you anticipate arising?
Well, I I think AI is only going to continue to become a hot topic in healthcare, as it is in all industries. But I think we're going to see really impactful improvements in how that technology is deployed. Even at Memora, we're progressing so rapidly right now in the way we design programs and guide those interactions that happen between our platform and patients. I think in the industry itself, you're going to see a lot more of other applications for that technology in the way that, auto-generate documentation around clinician and patient visits, predictive analytics to hopefully anticipate when patients get off track. These are the new frontiers and the potential promise of AI as we continue to hone in that technology and ensure that it's well designed for the use in healthcare.
And my final question, Matthew, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Yeah, it's a reminder that empathy is non-negotiable in healthcare. I think that the industry and the infrastructure of healthcare right now has tried to squeeze out every last piece of energy a clinician has to do a variety of tasks now, and 12 hours in a given shift is not enough to do that. My wife always asked me why I couldn't eat lunch during my shift, and I just said I can't. I can't explain to you why, but I can't. There's no time. And yet that time would still spill over into the evenings. But we have to remember that as clinicians, we exist in this critical moment in the lives of patients. We have a privilege to walk through that door into a patient's room at a moment in time where they're experiencing often a significant event in their life. And they're worried about minutes and hours and days and weeks to come. And we can't sacrifice that because we don't have time. That narrative has to change. And the way we do that is to start to leverage technology that can take other things off of the plates of clinicians and allow them to spend that moment in the room with the patient. I talked about this in the article a bit, but there exists this moment when you talk to a patient where you really do need to forget about the pager and the in-basket messages and everything else on your plate, because the engagement there is critical. It's critical for their own satisfaction with healthcare, but more importantly, it's critical to the clinical outcomes that happen after they get discharged from the hospital. And so companies like Memora need to think about how we build technology that augments the care clinicians provide, accounts for care team satisfaction, and honestly just feels like it's the right tool finally at like the right time for clinicians.
Matthew, thanks for sharing your perspective and insight. Thanks again for coming on the show.
Appreciate it, Kevin. Thank you.